So, good afternoon, everybody. Good afternoon. As I was saying earlier, my name is Edward Hardy. Everybody knows me as Ed, and I'm part of Far Southeast Family Strengthening Collaborative Community Engagement Team. I'm the Community Engagement Coordinator there. Uh, tell you a little bit about Far Southeast Family Strengthening Collaborative. So, the Far Southeast Family Strengthening Collaborative has been in Ward 8 for over 28, going on 28 years. Our mission is to be a catalyst in the community. So what that means is we want to push the residents, we want to push the agencies, the partnerships, the partners, the community stakeholders. We want to push them all kind of together and make sure that everybody knows who each other is and they're utilizing the services that they have. We primarily are a family-based organization, so we work with families with kids under the age of 18, but we also work with individuals as well. So our program objective with Advancing Health Literacy, we want to do a number of things. We want to enhance the understanding of health information. We want to improve access to healthcare services because the thing is, well, now we're kind of getting into a space where a lot of things are coming east of the river into Ward 8, but we want to make sure that our residents know that it's coming and it's there, and also know how to kind of navigate those areas as well. We also want to promote healthy behaviors and self-management skills. So we want to make sure that you're not only being told or instructed what to do, but actually being able to take those tools and use them on yourself daily. We also want to address the health disparities and social determinants of health. In Ward 8, we have some of the highest health disparities in the city. Ward 7 and Ward 8 and Ward 5. It's just very necessary that we have that information out there because we have to tackle this thing, and we kind of have to tackle it from a different perspective because different cultural backgrounds, different demographics, a lot of those things really set the pace of how we do our community engagement and how we put out the work. I'm gonna move to the next slide. Power of community engagement. I mean, just understanding that tool in itself will really get you there, right? That'll get you at that first point of engagement. That'll get you to that resident, and having that information and being able to give it to them directly. Because in our communities, a lot of times we lack trust. So a lot of times you'll have situations where you may want to help somebody out, but they really don't want to help because they don't know you. You know, and sometimes that can really be a serious barrier because our residents don't always like to come out of the community. So you have to be kind of diligent, and you have to be making sure that you are committed to making sure they get that information. That is very, very important, especially in community outreach and engagement. And I can read about what we do as well. So we collaborate with the Department of Health to develop plain language health materials. As we talked about earlier, some of the health messaging we put out there, the flyers, those flyers, they got important information. So we're just making sure that it makes sense and it makes sure that our residents can understand. Host workshops and educational sessions. One thing you may, if you do not know Far Southeast Family Strengthening Collaborative, we're great at engaging communities in events and workshops, right? We have support groups, parenting support groups. We have support groups when it comes to health, right? We have something that we call the lunch and dinner with a doc. And some of us are in here that we partner with that do that. And what that happens is we'll get the community involved, we'll provide some meals, and we'll have that provider speak about what they do. Then have the community residents and stakeholders ask questions so they can get a real understanding about the work that's being done and where they can find those resources at. Also, we collaborate with that talked about that, collaborating with community organizations and providers. We also utilize digital platforms for health communication. So, like they talked a lot about the QR code. Now, what we did find out with the QR code, although it is effective, there are some times where you're going to have some challenges just because people's phones may not do a QR code. You know, they got to download. So sometimes that can slow up the process of getting that information. So we have learned that. So we're kind of like tweaking those things out and still utilizing the QR code as well. advocating for policies and supporting health literacy. We always advocates. I'm a personal trainer by trade. I'm always in the community making sure that I'm promoting health, not only in the community with our staff. That's just something that I'm very passionate about. So that's just what we do. I'm gonna go to the next slide, and that's just me out there in the community. That's actually at the Ward 8 well. If anybody's familiar with Ward 8, the well in Oxon Run. Oh, I'm sorry. So that was just about what we talked about, what we do. And here's another slide. This is one of the workshops I talked about. It's kind of sort of like a focus group, the lunch and dinner with the docs. These are very important, right? Because this kind of gives you time to be with the resident and time to be with the provider and kind of close those gaps. So they can kind of see who they're talking about, see who their specialist may be, see who's in the community that, okay, I need to have a pediatrician or I need to have a surgery, whatever the case may be, but knowing who those people are and knowing that they're around and being able to talk with them, because sometimes people feel like they can't talk and answer certain questions, especially if they're being bombarded with things that may be going on with themselves. So just having these workshops, I think, is very, very, it's very impactful. So if any one of you would love to partner, if you're in any organizations or agencies that want to do a partnership with the lunch and dinner with the docs, please reach out to me, and yeah, we can get it done. So I'm going to talk about some of the successes and challenges that we deal with at Far Southeast with the Advanced Health Literacy Program. So with our successes, we've increased awareness and understanding of health topics. As I said, our workshops have really been instrumental in helping us get that message across. Improve health behaviors and self-management. As I said, being able to provide that information to residents, and you can walk in and get that information as well. Thank you. Yeah, I got a little lost on that. So yeah, being able to provide that information gives them the strength, gives them the confidence to be able to say, okay, I know where to go, I know what to do, and if I don't, let me backtrack to Far Southeast and maybe I can find out what I need to find out. Strengthening partnerships and stakeholders. One thing I heard a lot about in there, I didn't say a lot of it, but our partnerships are gold. That's kind of like what we do. Like, we have to be attached to the community and community stakeholders and partners in our primarily Ward 8, but across the city. Like, that is very important, and being able to have those conversations. It's not just about networking, passing the card, but actually showing a face, following up, having those relationships where you know somebody's going to reach out to you. Not always you got to reach out to them, but you have to build that trust. So community partnerships, that's something we really care about. We also enhance access to healthcare services. Big thing been going on in Ward 8. We haven't done it directly, but through the advocacy of our organization and other organizations like us, and from the community residents, Ward 8 has just been like kind of, what's the word I want to say? It's been pushed. It's been pushed with all kind of healthcare. Even the Department of Health is now located in Ward 8. So big things happening for Ward 8 with enhancing the access to healthcare services. Recognition of health literacy's importance. We got to keep, we have to keep pushing the message out, right? It doesn't stop. Like, even into this cycle, we have to continue to push that advanced health literacy message out, because people are still having issues. People are still dying from different diseases. So it's imperative that any organization or agencies push the message of health, right? Whether you're pushing the Living Well portal, whether you're pushing your healthcare providers, whether you're pushing insurance, just making sure that somewhere in your agency or organization that is happening. Our challenges, you know, you're going to always deal with challenges, and one of those challenges is limited resources and funding. As you know, the Advanced Health Literacy Program is ending this cycle. So now we have to continue to do our work, but we have to find other resources in order to keep that work going and to make it effective. That's been a big challenge. Advanced Health Literacy and Department of Health, just that whole initiative opened a big door. And because it closed not so fast, but it closed kind of prematurely, we really got to find ways to find other resources. Language and cultural barriers. That wasn't the toughest thing for us, but we noticed the change coming, right? We noticed the change coming. We noticed that different demographics were moving more closely to where we are. So having that information, as our marketing director reminded me, having that language line where people can call in and get the information they need in the language they need. So, and also plain messaging, making sure people can understand what's being read, what's being given. All right. And then we have resistance to behavior change. You know, everybody you give information to is not going to utilize it. You know, that's just the truth and the honest, you know, in my honest opinion. But you got to keep pushing it. And sometimes that can get hard for community engagement if people don't engage with you. You're trying to give them information. They're like, I don't want to see that. I don't want to hear about it. What you got to give me? You know, so that was an issue. It still is. And I think that it always will be. You just have to keep going and persevere through it all, especially if you're a community engagement person. Adapting the interventions to diverse needs. So as we talked about the language barriers and things that and understanding the cultural dynamics in your communities. Ensures sustainability. Making sure that the information you provide is something that's going to be sustainable to the person that's listening, right? You know, you may have some information about something that a person may not even have an issue with. So you don't want to try to push those things down people's throat. You want to try to make sure that you're doing things and providing information, messaging, and engagement with the understanding that this is something they can use long term. All right, and I think, yep. So trainings. We got to go through trainings. Whether it was the Living Well peer group training that we went through and completed. Other trainings that's attached to healthcare, attached to advancing health literacy in other ways outside of just the Department of Health. Just making sure that you continually sharpen your toolbox, right? So reading it out, training plays a vital role in improving health outcomes by ensuring individuals have the knowledge and skills to make informed decisions about their health and navigate the healthcare system. Self-explanatory. Motivational interviewing, cultural competency training, writing workshops, health communication strategies, digital health literacy workshops, and Living Well peer leader training, as I spoke about earlier. Next one. And that wraps up Far Southeast Family Strengthening Collaborative and what we do with the Advancing Health Literacy Initiative.